and another 30,000 will be in danger of losing their health insurance because their clients will be receiving drastic hours cuts to their services. What this means to these hardworking individuals is devastating. They will lose the coverage they rely on to remain healthy. Ironically, in order to care for our state's most vulnerable and people with disabilities. At this time, I'd like to introduce a member of our union to tell her story about health care. And she'll be telling a true testament for why change is really needed. Rodika Mukana.
Good morning. My name is Rodika Mukana. I live in Los Angeles, Hollywood area. I'm taking care of my daughter. The truth is, I'm doing this job for 6 years. The truth is, we need more hours and more benefits. It's impossible to live like this. It's impossible. If they cut our hours, we cannot have medical, and we should have vision. We should have, our salary should be a little bit better. It was expensive.
Rowdy.
All the workers, we save a lot of money from the hospital and from the institutions. And we should have a little more benefits than we have. So that's my message today. Thank you so much.
Thank you, Rodika. And I might add that for every person that is uninsured and forced to turn to the county emergency rooms for health care, it costs the county and the state thousands of dollars annually, money that could be placed into our state's budget and resolving that crisis. It's easy to see from that personal story that healthcare reform is not only what Californians want and need, it is a necessity. And in difficult financial times like today, it also has to be a part of our state's solution to our budget crisis. That's why we're here today, to make sure that our voices are heard loud and clear in the halls of Washington, D.C. as this topic is debated. We must remind Congress that we will not allow another day to go by when people are unable to seek the treatment they need to battle cancer because they don't have insurance. That we must stop insurance companies from denying someone coverage because of a pre-existing condition. And that health care is a must for every man, woman, and child in this country, and not a privilege for the select few. To help us kick off this event today, over the next few minutes, we'll have several guests offering different perspectives on this issue. We're honored to have Congresswoman Judy Chu, and hopefully later, Congresswoman Laura Richardson, who will be telling more about what will be taking place in Washington, D.C. over the next several days and weeks, and who will be taking today's voices and spirit back to Washington with them as this issue is debated. We have Dr. Paul Song, who will describe for us what's at stake for our country if healthcare reform is not achieved. Assemblymember Mike Ng, who will inform us of what's at stake in California. Dr. Rishi Manchanda and Jose Gonzalez, who will be telling more about the impact of healthcare reform on our communities. I encourage everyone who's attending our Healthy Works Fair today to take advantage of the many opportunities to make sure that their voice is heard. We have traditional activities like writing a letter and non-traditional approaches to reach those who are disaffected or yet not fully motivated. They will have the opportunity to get information, see a movie that stokes conversation about our healthcare system, call and email their congressman, and to be a part of videos themselves that make a true testament to the importance of the issues in millions of lives of Americans today. Only by taking action can we show support for legislators who are true champions for healthcare reform. And it's now my honor to introduce a champion for healthcare reform, Congresswoman Judy Chu.
Well, I'm Judy Chu, and I have the honor of being a Congress member for a whole month. And I'll never forget my first day as a Congress member. I was sworn in on the floor of the halls of Congress in front of the 435 members by Speaker Nancy Pelosi. That night I was asked to go to my first committee meeting, Education and Labor. They said it would go late because it was on the healthcare reform bill. They said it would go to 1 or 2 a.m. It went to 6 a.m. But I was